Gwikira mask riria mundu ari muingi-ini ni watho wagiriirwo ni kurumirirwo ni mundu wothe kuringana na watho wa COVID-19. Andu makoretwo magikira mask itiganite kuringana na uhoti wa mundu, na ona gutuika andu aingi marahuthira mask iria itumagwo na ngora na iria ciikiragwo maita maingi, kuri na gicunji gikoretwo gikihuthira mask iria ihuthikaga thibitari-ini na ciagiriirwo ni gwikirwo rita rimwe, na haha kuringana na ministry ya ugima wa mwiri hari na ugwati mumbeke.
Given that surgical masks are supposed to be worn for no longer than 1 day, their disposal along with that of empty-hand sanitizer bottles and soiled tissue papers is leading to a growing ugly trail of clinical waste in the environment.
Ministry ya ugima wa mwiri irauga ni ikoretwo igitheria na gucina giko gia thibitari uria kwagiriire, na Kenya ni marorio makorwo na umenyereri magite mask ici kuona itifuthaga na ona gutuika ni irarigiriria hanene mundu kunyitwo ni murimu wa COVID-19 ciahota gukorwo iri itari-ini ria maundu maria maracungiriria wongerereku wa namba cia arwaru guku bururi-ini.
Health experts have determined that viruses and germs may remain attached to these disposed masks for various periods of time. Those who pick such discarded masks, particularly our children, are at risk of infections. There is also the danger of infection by those who come into contact with face masks blown by the wind.
Kuongerereka kwa namba ya arwaru aria riu makinyite makiria 23,000 thutha wa 506 kurwara gugithiaga na mbere na kugatha uhoti wa mathibitari, ministry ya ugima wa mwiri yugite gutire kurehiriria.
In terms of bed capacity, you know very well that the counties have been charged and are working hard to meet their quotas of beds that they require. We know from where we are in the pandemic that we have not reached a point yet where we can say we have been overwhelmed.
Thirikari yugite kwa ihinda riri irathima ikundi cia andu aria mangihotererio ni murimu wa COVID-19 kumana na itumi itiganite, riri namba ya andu aria makuite kumana na murimu uyu riu ikinyite 388.
We are going after what we call the risky and vulnerable groups. And we have identified those risk and vulnerable groups. There are very many cohorts of these vulnerable groups. We have talked about older people, people with comorbidities, people whose immunity is weakened. These are groups that we are now targeting.
Utheru wa mundu kiumbe na wa maria maturigicĩirie ni wa bata bara-ini ino ya kuhurana na murimu wa COVID-19, no ria kuri na wongerereku wa uhuthiri wa mask guku bururi-ini noguo kwahota gukorwo na ugwati wigie ugima wa mwiri to umuthi tu no nginyagia matuku meguka angikorwo akenya matigukorwo na wigĩrĩrĩki wa gute mask ici. Ngiribotera Inooro TV, njitagwo Gathoni Wanjihia.